Hey guys, welcome to week 9 and 10. So these weeks are going to be related when it is referred to the problem. Although your week 9 problem is up there, you will have something similar when it comes to week 10. So these weeks are kind of paired together. 11 and 12 would be very similar, as well as 13 and 14. So the next 6 weeks are going to be very much related and in those 2-week blocks related to each other. So I just wanted to kind of walk through this so you guys understand. It's a little different than what we've done so far. But in week 9 and 10, you will see, just right now, you will see the week 9 information. So in week 9, I want you to watch this video, obviously. I'm posting it I'll be posting it here in a little bit so that you can kind of walk through this. But then what I want you to do is read week 9's problem. So you are the primary healthcare provider for a team of Emily, you're going to be with female indoor volleyball athletes, and Kim, you're going to be with male soccer athletes. You're responsible for developing a comprehensive injury prevention program for this team. So just to start out, you're going to use literature to determine some common pathologies most often associated with this activity or sport. So you may or may not find literature, but what I want you to do is think about what activities these patients go through every day in their training, on and off the field, and what might entail some common injuries that happen. So if you're not able to find that literature, evaluate some of those biomechanical forces, whether it's running, cutting, swinging of the arm, hitting a ball, right? So make sure that you go through that and decide on those common injuries. So for the assignment, you're gonna develop a list of pathologies with a detailed 2 to 3 sentence rationale on why or how the athlete might be at risk of these pathologies. So in this section, you're going to describe the motions that they go through, some of the compensations they might have that might develop the injuries, and try to find as many citations as you can to go with it. If it is an acute injury in nature, you should include the natural progression of the disease. So yes, like a football athlete, they get contusions in their hips or their thighs, but what could possibly progress from that if it was untreated, or if they injured it again and there's that repetitive injury. I kind of show you like a lateral ankle sprain could turn into chronic ankle instability down the line if not strengthened and not looked after, and then could possibly turn into osteoarthritis. Then I want you to create one educational tool to enhance your population's knowledge and understanding of those common injuries. So pick a few, and this might be just some information about how they can protect themselves before the injuries occur, what kind of risks, how often do patients in this population have these injuries, and what strategies they can take with their activity level. This tool must incorporate your knowledge of health literacy. So we know that not all of our patients can read at a high level like we can. So using common basic language. And I would like you guys to branch out of your normal methods of providing literature to a patient. So we've done infographics. So maybe developing some kind of video presentation, or get creative. I'd like to see those creative juices working. You also should consider some of the learning characteristics of your population. So males, females might learn a little different, not always sure, but college students might learn a little different. How would you address this age of students? And you just tell me why that is important. So you should submit all of the documents, the list of pathologies, as well as your educational tool to this by the end of the week. Next week, as we move through on to like kind of a prognosis, and once they've had these injuries, what does that look like? That information will be put up, but for right now, you should just focus on possible injuries for this patient population And then as we go on, that patient population might change or be adjusted a little bit. Also, don't forget reflection log 4 is due on Sunday, so make sure to look over that. And I hope you guys have a great week. Please let me know if you have any questions at all. Thanks.